the middle.
All right, good afternoon, everyone. Thank you for joining today for our monthly health equity meeting, and we are very grateful and happy to have you all. And thank you for the audience for joining. And we'll be recording this meeting via our Facebook Live. Without further ado, I will hand it off to Karina, our program manager.
Thank you, Sarahi. Greetings, everyone. Thank you so much for coming. My name is Karina Lamarck, and on behalf of senior leadership here at Anne Arundel County Department of Health and team members from our Health Equity and Racial Justice Office, I would like to warmly welcome you to today's countywide equity meeting. Thank you so much for showing up. Many of you have supported our efforts of advancing health equity for some time. You've participated in our meetings on a consistent basis. So we just like to jumpstart our meeting by acknowledging your support of our office, and would like to thank you because certainly there is strength in numbers. It takes a village to advance health equity. We recognize that we cannot do this work alone. So thank you all for participating, whether in person or online. There are so many of you throughout the county who have shown up, and collectively we work to address health equity here in the county. There may be a few of you who are participating for the first time or second time. I know that there is at least one person who has done so. I just want to pause and also acknowledge you. If you'd like to raise your hand, if you're joining for the first time or maybe the second time, raise your hand virtually, or even if you're here in person and joining for the first time, we just would like to greet you with a smile and say thank you for participating. Okay, well, thank you very much for showing up. Today, we will be celebrating the launch of one of our anchor programs, the Community Health Ambassador Program. And while you're going to hear more about the successes of that program a little later today, the successes under the programmatic leadership of Raymond Medley, I would like to just announce that we will be taking a group photo with senior leadership and staff members of our office. We invite you to just linger with us for a little longer beyond the end time for today's meeting so that we can take a group photo. Our Office of Communications will be joining us to coordinate that effort, and we'll be sharing instructions a little later on. So if you have opportunity to do so, please feel free to join us. We have a full agenda today, and certainly we honor your time. So without further ado, I'd like to turn your attention to our health officer, Dr. Kalia Naraman, who will provide updates on COVID-19.
Thank you, Karina. Good to see all of you here in person. I feel like our room gets a little bit bigger each time. It's really nice to see you, including those of us on the virtual as well. Rightfully so, our COVID update gets smaller and smaller as we're able to focus on many things during this conversation. What we're seeing is that we have, for the past few months, been pretty steady in terms of our case rate. Now it's in the somewhere around 10 or so, give or take. We've been very steady in our hospitalizations. We're between 20 to 40 between the two hospitals. But we do know that there's going to be more cases as the winter, as the days get colder and winter comes. And so it's really important to understand what we can do, right? We've talked about these things, but there's some details that I want to dive into. We've talked about staying up to date on your vaccines. We've talked about making sure that you have tests available, using masks, and we can go a little bit more into that. And then, of course, getting treatment if you have any health conditions if you are positive for COVID. I want to dive into the vaccines for a minute. Some of you may know, but I don't think everybody knows that there is a new booster that was approved about a little over a month and a half ago. It's an updated booster. It is updated to include the Omicron variant. We talked a lot about Omicron for a year, right? Now the updated booster has that. And it's really important for people to get that updated booster because it provides a increased level of protection, right? What we've seen is maybe about 6 to 7% of people in the county have gotten that. That is not a lot. That is really small. And I think that a large part is because people don't realize that it's new, that it offers increased protection, right? Most of the folks that haven't gotten it say, well, I already got a booster, why do we need another one? And very much like we do with the flu shot, which you get every year because it's updated every year. It's a new vaccine every year, right? Not entirely new, just little pieces are changed to be updated. Same thing is happening with the COVID vaccine. And so wanted to make the space to answer any questions you have, and then also talk about how you can share that word out with your, particularly our community health ambassadors, getting that word out there, that getting this updated booster is going to be really important to be able to do, and to not wait forever, right? These are the next, in the next month and a half is really important to get that COVID booster and that flu shot. So you're protecting yourself. So I want to stop there, ask what you're hearing about vaccines and what questions do you have before we move on.
I think people want to know, I guess they're leery about trusting that new vaccine. That's what I'm hearing.
Okay.
They just don't trust it. It hasn't been out long enough.
Mhm.
Don't know the science to it, so they're not getting
Okay.
it. Until a lot of other people get it down the road, maybe they'll think about it.
Okay. All right. What else are we hearing?
I know a few people that have actually gotten it.
Mhm.
One of my friends did.
Yeah.
I haven't gotten it. But I mean, I've heard of a few, like I said, a few.
Are these being offered with no charge still?
Yes.
Good to know.
I saw something in the chat. There is a Pfizer and Moderna updated booster. So these new boosters come in both. Just so I think the comment I saw said it's just Pfizer. So if you have Moderna pass, but you can actually decide which booster brand you would prefer. for your booster.
Other feedback, what are you hearing?
Yeah, I just have a question. My name's Edith Perry. I represent Delegate Jocelyn Payne Melnick. And have you guys reached out to the senior community, you know, in reference to the booster?
Yes, so we're right now working on some education campaigns, but we've also been vaccinating at community centers, so working with the Department of Aging and Disabilities to
Right.
actually go into senior centers, and we're vaccinating at least one senior housing development, but trying to create some specific messaging for more vulnerable populations to make sure that folks understand not only the importance for everyone, but particularly if you are older or have underlying health conditions.
And what senior housing development did you say that was?
I don't remember, but we can get that to you.
Please. Thank you.
I see a raised hand from Pete Field, the County Executive's Office of Diversity, Equity, and Inclusion.
Yes, thank you very much. This is a personal question, actually. I took the booster and I took it back in, I want to say May or June timeframe. And you may have said it and I missed it, but if I took my shot in the June timeframe, did it include the Omicron update or not?
It's a great question. I'm glad you asked that. So so this new booster updated one was approved in September. So anybody who got a booster before then needs to get a new one.
Yikes. Okay, thanks a lot.
Yep. Think of this as your seasonal COVID vaccine now, kind of like your seasonal flu shot.
I will spread the word.
Thank you, Pete. Any other raised hands or questions or comments in the chat? We can address at this time.
I'll tell you, I got my booster probably about 3 weeks ago now. It was a non-event, if that does you any good. Actually got my COVID booster and my flu shot at the same time.
And you're saying no. Side.
The spot, usual like little soreness, but other than that, no. I felt fine. I'm a little tired maybe at the end of the day, but it was a long day. I woke up the next morning fine. I know results may vary, but it was a no big deal for me.
Hi, Dr. K. Pastor
Hi,
Gay
yeah.
Green Pastor Gay Green Card, and I'm representing the Interfaith Advisory Council. So just for clarification, I understand the new booster is Pfizer. So if you have the Moderna vaccine, so is that Pfizer booster compatible for the Moderna users?
So one thing to make sure that we clarify that Pfizer and Moderna both have an updated booster that includes the Omicron. So you can, when you're scheduling your appointments, depending on where you're scheduling it, look to see what they're offering, but they are compatible. You can mix and mingle. So it's really up to you what your preference would be, but it does exist for Moderna and for Pfizer, and you can ask that question when you're being scheduled. Some providers, just depending, may have only be offering one, but it is fine to get a different booster than your original series, or if this is a second or third, or even a fourth booster for some folks, it's also fine to mix those vaccines up.
All right, and there are two questions in the chat. Is there a new booster same as a bivalent vaccine?
The bivalent vaccine is
bivalent.
that updated booster. That is correct.
Okay, and is there plenty supply of the new booster?
Yes, we have many appointments available on our website. I don't think I've heard of any supply issues with pharmacies or providers. It is readily available, pretty much same day if you want to do.
No more questions in the chat.
All right.
Thank you very much. Appreciate that overview. Now I'd like to turn your attention to our Deputy Health Officer, Tony Gannon, who has already shared her wealth of information and knowledge. She will talk about monkeypox and provide an overview.
I'm gonna do this really quickly because I know we have a full agenda and we still have to get to flu. So if you could actually, Sarah, go to maybe the third slide. I won't go through how it's spread and the symptoms. We'll skip to the next one and start with demographics and vaccination rates, because I think this is really important. Again, we're seeing most of our cases in male residents. 65% of those cases identify as gay or bisexual, and this also includes people who may not identify their gender as male. So we're looking at really a broader scope of people in that group. But one of the things to note is that we are seeing more cases in our non-Hispanic Black residents. And we're also seeing a disproportionate number of cases in our Hispanic residents. So as we're having this conversation with your various networks, please encourage folks to get vaccinated. This is another one where we have plenty of vaccine. We have appointments that go unfilled several times a week. And if you look and compare the vaccination rates on who's being vaccinated as compared to those who are actually making up the cases, we do again see a disparity. We are vaccinating more white residents than we are our Hispanic and Black residents. And so we want to make sure that we're getting that information out there and folks are coming to get vaccinated. We also see it skewed a little bit in the age group, right? So we're seeing mostly in the 30 to 39-year-olds. They don't make up 45% of the folks that were vaccinated. So again, if we reaching out to your networks and folks that you know that need this, and also thinking about, we don't have any, we skip to the next slide. We don't have any restrictions on who is eligible. So you determine your risk factors and you let us know. So if it's someone else in your household that you think may be high risk and you're getting it for that reason, if it's occupation specific, you can come and be vaccinated. So again, it's 2 doses, goes right under the top layer of your skin. And like with most vaccines, you are not fully vaccinated until about 2 weeks after that series. And we can also vaccinate people post-exposure in a certain window. So it's just really important to make sure that you're reaching out to us if this is a concern for you or your family members. So you go to the next slide. Okay. And again, this just underlines what I was speaking about. Initially, we were looking at those that were most high risk and most likely to potentially contract monkeypox. We're at a different space. We have more than enough vaccines. So again, if you identify yourself as high risk, we will vaccinate you. A really simple process, similar to signing up for a COVID vaccine. You go, you pick your location, date, and time, and come and see us, and we get you vaccinated. I think the next slide actually will outline where we are in the county. So at our health centers in Annapolis and Glen Burnie, we have a drive-through, another drive-through in Glen Burnie, at Bay Meadow, at Moyer, Louis Scott in South County. And we've done some community clinics with partners, so we're getting out there and trying to see, meet people where they're at. But yeah, this is where we are. Not a whole lot has changed since last month, other than we continue to see the cases are low, which is great. So we hope that vaccination and education have been working. And we've seen that across the state and the country, that cases are continuing to go down, which is excellent. We want to keep that trajectory and remind folks that vaccines are readily available to them. That's it for me.
There is a question in the chat. Monkeypox vaccine clinic registration is available. Oh, okay, this is just information where to find monkeypox information, how to schedule your vaccine. So it's www.aahealth.org.
So much for amplifying that message. Appreciate your updates, Tony. At this time, we are going to turn your attention to Jennifer Snyder, who is our bureau leader of disease prevention and management, who will talk about the flu vaccine and give an overview and updates. I know my family and I, we received our flu shots yesterday. So this is something very timely as we seek to prevent the impact of flu in our community.
Awesome. Thank you guys so much for having me. Just going to talk really briefly about the importance of getting your flu vaccine. I know that Dr. K talked a little bit about it. I also got my COVID and flu together and was totally fine. And I'm glad I actually just got it out of got it off the list and got it done when I was able to. So just wanted to really briefly talk about the flu. If you can go to the next slide. So flu season occurs in the fall and winter. So most of the time, flu activity does peak in December and December through February, but it can last as late as May. Flu cases now are a little bit higher than usual for this time of year. And so we are a little concerned about these cases soaring in the next couple of weeks. So that's why it's really important for everybody to go and get your flu shots. In 20 and 21, the flu season was unusually low. And that again was when we were in the middle of COVID. There were lockdowns, everybody was social distancing, everybody had their masks on. In the 2021-22 season, there was a little bit of an increase, but it was still lower than previous years. Again, it's because we were social distancing, we were wearing our masks. People, were kind of still staying home. We were creeping out a little bit. But again, because we're kind of, we're back to normal activities. We're not wearing masks, as we we're back to kind of out and about in public. It's really just really important. I can't say that, encourage everybody to get their flu shots. So, unfortunately, our flu season cannot be predicted, but we know because it's a little bit higher than usual already that we could see high number of cases this year. Flu and COVID vaccines are safe and they're highly effective against serious illness, hospitalization, and then death. And like Dr. K said, it's very important for you to get the flu shot every year because some of the viral strains in the current vaccine may have changed from the previous year, and immunity to influenza viruses after you get the vaccine decline over time. And so because we weren't exposed to as much flu for over the past a couple years, our immunity to flu could be even lower than in previous years. So again, I know I'm going to sound like a broken record, but it's important to get your flu shots in addition to the COVID bivalent booster. So we do recommend that everybody gets our flu vaccine in September or October. However, vaccine, like I said, the flu viruses continue to circulate. They can go as late as May. And so you can get the flu shot anytime, as long as flu is circulating, but we want you to get the flu shot as early as possible. So like now is the perfect time to get the flu vaccine so that you're protected, that you are protected from getting the flu. So you can go to the next slide. So how can you protect yourself and others? Again, a lot of these messages are very similar to the message that we've been talking about for the past couple of years with COVID. The flu vaccine, just like the COVID vaccine, is the best way to prevent the flu. We want you to cover your coughs and sneezes. We want you to practice good hand hygiene. And then big thing is we want you to stay home when you're sick. Not only, that's for COVID, that's for anything, COVID, flu, we're seeing increases in RSV in our kids. So again, keep you and your families home if you're feeling sick. The flu vaccine is recommended for anyone over the ages 6 months and older. There are for the seniors, there is high dose vaccine. High dose vaccine is just a little bit of a stronger flu vaccine than the other flu vaccine that we give to the general population. That vaccine is available for individuals age 65 and older. Not all locations, if you go to pharmacies or even your medical provider might have that high dose vaccine. The health department does. We do have a little bit of that vaccine, and we are offering the flu vaccine, the high dose flu vaccine at the senior centers. Like Tony had mentioned, that we are partnering with them, not only for COVID, but we partner with them for the flu vaccine as well. And if you go to the next slide, this is just some locations that we do offer the flu vaccine currently now. We did have 2 community flu clinics in October that we have done, but now moving forward and actually starting on Wednesday, we are partnering with the Anne Arundel County Public School System to offer flu vaccines at some schools throughout the county. This is open to Anne Arundel County Public School System students, families, and just anybody. So it's open to the general public. You can go to the aacps.org website to see a list of clinics. We are, just to increase access going around the county. We are starting at Annapolis Middle School on Wednesday evening. Those clinics are in the evening from 4:30 to 6:30. The flu shots are available at a lot of places, community pharmacies. I know those are very popular for COVID vaccines. So they also offer flu vaccine or your medical provider. And then we also have flu vaccines that are available at our health centers in Glen Burnie and our Pearl Health Center in Annapolis. And those phone numbers are there. You can call and make an appointment. And then I think that's it. So thank you. Happy to take any questions.
Thank you, Jennifer. I did see one question in the chat.
Great. Stephanie Evans asked, wondering if you currently have the flu really bad as I do, should I still get the flu vaccine? And how long do I have to wait?
So that's a good question. If you tested positive for the flu, that's different from if you have flu-like symptoms. because there's a lot of different viruses that can cause flu-like symptoms. But there are different strains of the flu that are circulating. So even if you have the flu and you didn't get the flu shot yet, you should get the flu shot once your symptoms resolve. Usually there's 4 different strains of flu virus that we're being protected against.
Yes, she said she tested positive.
So much. If you have additional questions or comments, feel free to input them in the chat box. We'll be happy to address them. Or you can certainly email us at healthequity@aacounty.org. I'd like to now turn your attention to Raymond Medley, who will be providing an overview of our Community Health Ambassador Program. We are really excited because we recently launched this program and we have our Community Health Ambassador partner representatives and leaders here with us today. And so he's just going to talk about the program, past work, and what we will be doing moving forward.
Thank you, everyone. Pick the right screen here. Thank you, everyone, just for coming out today and just to be able to talk about our Health Ambassador Program. This is our 2nd year of it, where it's just like fully funded with our partners. Let me go to the next slide, please. My Health Ambassador Program is to build capacity in community, is to hire health ambassadors to do some of the local community work and approach in our neighborhoods. Our focus this year is with mental health and being able to access to mental health services, including COVID, to our underrepresented population and minority groups. And we recently held mental health first aid training where up to 30 health ambassadors were certified as trainers or certified as to be able to facilitate sessions in the community. Our partners, we have some in person today, we have some virtually. First Christian Community Church, want to raise your hand. We have Growth Matters, I believe it's on virtually. We have Heritage Community Church, want to raise your hand. We have the Center of Transformation, but I believe it's on virtually today. We have My Life. Hello. Who is in person with us today. We have the Center of Health. Awesome. We have the Community Action Agency. And last but not least, we have our Kingdom Care partners. So we have a great collaboration of partners who've been doing this work around the county. They're really boots on the ground. Really getting the work done. If you want to go to the next slide, please. Just some of the work that we've seen them do and just different parts, like they're out in the field. Is that you? That's you? Oh, okay. We got some out in the field, really doing the work. They're in the neighborhoods, they have food drives, they have community events, they have door-to-doors. They're even giving people at vehicles at food drives, so they're really out in the community. So when you see them, just know that they're really doing the work of this kind of spreading out the messages that the health department is really trying to get out to the community. And we really believe they're valuable because they are the faces of the community. They know the community and they work in the community just so extremely well. So there's already a lot of, so I believe that Virgil shared earlier, sometimes there's a trust factor that comes in from government agencies. So when we trust our partners, we know that they're trusted to go in the community and they know how to communicate those messages well. Next slide. And as I mentioned, that the Health Ambassador Program, in partnership with the Anne Arundel County Department of Health, is the focus this year with mental health first aid, mental health services, COVID vaccinations, and community resources and education around the county. Next slide. We just showing some of the work that they've completed in our last fiscal year. So over 25,000 doors were knocked on. Nearly half of those people was able to complete surveys or receive materials. There was a lot of engagement. Nearly 15,000 people were engaged in some type of community events, whether it's food distribution, or community services. I believe that number is a little bit lower because I believe they did a greater work than that. But even with how many people they helped to schedule it directly for vaccination appointments, our health ambassador was very active in the field. Next slide. And then this is just some of the other services they've done in demographics. They did like almost 13,000 face masks and almost 9,000 COVID kits were given out to the community. And we can kind of see that reach of the population, male and female, who were reached during that time of the program. So with our community health ambassador program, many of our partners are ready to go. They're very excited about the work that they will be doing in the community. We're excited about partnering with them in the work that they'll be doing. The health ambassadors will be also participating in monthly training, just so they can just be better skilled at being able to educate the community on multiple needs and multiple questions that the community may have. If anybody have any questions for us concerning the health ambassador program, or even partnerships for the health ambassador program, you can reach out to us at health ambassador project .org, at aacounty.org, and we'll post that in the chat. And we're really excited about this program, and I believe our partners are. I'm not sure if anybody wants to share anything about their experience in the last go around, anything brief they just want to share. So that would be, I'm looking at you, Ms. Palmer, so.
Well, important, first of all, thank you to the health department, because I think it's important that you partner with community organizations such as the ones that are sitting in this room, because we are the boots on the ground. We get to see those families on a daily basis, and they trust us. So I think it's a great partnership because we can come in with information and dispel the myths that they may hear and show them that we are here to support you and provide the resources that you need. So I think we're excited. We're ready to go. We're ready to get started, just to inform the community about the services that are important, and especially mental health. Especially, since COVID, there's been an increase in mental health. And it's important that our ambassadors are trained on how to notice those signs. And then we're talking about at Kingdom Care, providing those resources for them. Once you come in with a mental health crisis, having those licensed therapists to be able to meet with those families and provide those services is going to be extremely important.
Thank you, Julie.
Well, I can tell you that I'm going to put Virgil on the spot here. He was actually just out in the community over the weekend talking to people. Do you want to maybe share what you're hearing?
Even this morning, I was out talking to some people. There are a lot of people out there with some issues that they really need help. They're out there. One of them, I didn't want to walk out there, just took so long. But I gave them, the numbers and everything that we had from the training and everything. And it's back with me, I said, I need to call them first. They can help you a little more. But it's definitely a lot of people out there with some serious issues in the neighborhoods that I go in. A lot of people can't go in there. Because full of, that, area. But I go back there because I know they need help. And they've got younger children with problems too. So that's what I mainly try to reach. It's definitely needed. And like in a hurry.
Thank you.
We have Apostle Shanklin.
Yes, good afternoon, everybody. I'm Apostle Shanklin with the Center of Transformation, and very, very excited about this continued partnership. And as Lady Palmer said, we are the boots on the ground. We literally see up close what's going on, what is happening. We hear the stories, and this is nothing new. Somebody want to ask me how does nonprofits, how do churches navigate, pre-COVID, COVID, and post-COVID? And my response is in the same way we've always done it. We always have had the ability to pivot and to shift, to accommodate, and to adjust whatever's going on in our community. And the health department, with the leadership of Dr. Nilesh, has made it easy for us to literally be an extension of them to continue to provide the resources that is needed in the community. And as the brother said, our own mental health ministry here at the Center of Transformation, we've seen over 130 clients last year with people coming in with mental health challenges. And so, the health department moving into that area and with this ambassador program, we literally allow people the access to acknowledge and become plainly aware that, hey, I may have some challenges and it's okay. So I'm very excited. My team is very excited. And so all these partners are here. This is, I mean, we can all dance now because we got all these people here, and the way that we're gonna challenge and attack our community and man, Anne Arundel County, we about to be on the map. So y'all, some of y'all ain't had lunch because y'all not happy enough for me. Because Anne Arundel County is about to be on the map. I mean, with the leadership that we have at the health department, we're about to turn things upside down and become a model all across the board, not just in this state. But I look forward to things that we can do to impact other states who are flirting around with trying to do something similar that we're doing. So we're very, very excited here at the Center of Transformation.
And what we'll do is give you access to who all of the partners is and contacts to our partners. But we definitely want to be mindful of our time. So I'm going to pass it back to Karina and move on to our next slides.
I'm gonna cheat.
Oh,
I'm gonna
okay.
take a minute.
Okay.
And I wanna say that we launched this program a year and a half ago in a much more limited scale. And it's because of the work that all of you have done to show how valuable it is, how important it is that we were able to expand it, make it a permanent part. We're so excited to be able to continue this work and to grow it over time. So thank you for all you've done to make this successful.
Thank you so much. I certainly echo that sentiment. And our next speaker, I mean, it's very timely to have Dana Curry here with us today. We actually partnered with her and the Anne Arundel County Mental Health Agency to provide the mental health first aid training to all of our community health ambassador partner organizations. And so right now we invite Dana to just highlight the network of care. Again, this network is going to be extremely instrumental, right, in the work that we do to engage the community around mental health and how we disseminate information around the resources that are available to address mental health. So without further ado, Dana.
Thank you. Okay, so my name is Dana. I am with the Mental Health Agency. I've just put a link in the chat for the website I'm about to show you. This is the Anne Arundel Network of Care. I'm about to ask if I can share my screen.
You have it.
I got it. Thank you. Let me get out of there. So what is the Anne Arundel County Network of Care? This is a website, and such a broad variety of people here. And I think everybody here could find this useful in a way, either as a provider or a organization, a partnership that's interested in helping. So the Anne Arundel County Network of Care website serves as a central location. We've got provider listings in here, all kinds of resources, local, state, and national level, and all kinds of information relating to behavioral health, substance use, and crisis services. So I really encourage you to come back when you get a chance and really look through here, because I'm gonna like speed through just a few things here. But you're looking at the homepage right now for the website, and I'd just like to point out a couple things. So then I gotta move myself so I can see my own screen. So on the upper left corner, I'd like to point out that obviously right now the site is in English, but you can quickly translate to Spanish or Korean. That's the second or third most common languages in our county. Or if I clicked other here, this would take you over to Google Translate, and there's just a huge amount of languages to choose from that will translate everything in this site that I'm about to show you. The other thing up at the top I'm going to show you is over here on the far right. I've just touched my account, and you'll see this pull down menu. You can create a free account on Network of Care, which I highly recommend because it's a place you can save listings, articles, anything else that you want to come back to. So I'll just show you what my account looks like right here. So I've already created one, and I could log in. Let me go ahead and, whoops, that shouldn't have happened. Fun times. I'll show you what that should have done. Moving on. So like I said, this is the homepage for Network of Care. So the top box here, this is fairly new to us. And one of the things that's in here is a special news section devoted to suicide prevention and support. So I know you all have heard a lot about 988 over the last few months, the new National Suicide Prevention Lifeline number, and all kinds of different things now. Something that's going to be of interest to a lot of you is to actually find a local provider that can help. If you're working with somebody who's, been talking about suicide, things like that. So what I can do here, I'm going to put in the Annapolis zip code here, which is 21401. And I'm going to look within 5 miles. And you're going to see you have 2 different bars down here. You have service results and subcategory results. I'll kind of go between the 2 so you can see here. But these are different services within 5 miles of the 21401 zip code that specifically recommend that they can help with people who are thinking about suicide, things like that. If I go back up to subcategory results, the related subcategory for this is adolescent and youth counseling. Go ahead and tap that just so you can see it one more time. I'm still in the 21401 zip code. I'm looking for people who specialize in adolescent and youth counseling within 5 miles of here. And now you can see that there's 16 different services it found within this 5 miles of this zip code. Now, what I could do up here, if a telehealth is important to a lot of people right now, so I could click that on at any point, anywhere I'm searching for a provider in this website, and it will take it down to only telehealth, for people that are offering telehealth at this time. But right now I'm going to go home. So moving on down the website. So another way to find a provider near you or a facility near you, you have 2 choices next right down here. You can, if you already know exactly what you're looking for, you could type it in here and then put your zip code and search. Or if you'd like to take a look at all the categories to choose from, you could go ahead and click view categories down here. So let's take a look at the first one here. This is addiction and substance use. And let's take a look at some outpatient providers. So again, I'm going to do that 214 Annapolis zip code and do within 5 miles again, and go ahead and search. And so now you can see I found 8 different services within 5 miles of 21401 that specifically mention that they have comprehensive outpatient substance use disorder treatment. I'm going to go ahead and go back home. So as you can see, there are quite a lot of different categories, and it's not necessarily health providers as well. You're going to find things on here such as homeless and housing services, employment, financial assistant, help with bill pay. So scrolling further down, you're going to see some direct links to the Anne Arundel County Department of Health website, the Crisis Warm Line, which we rerun, our website, the Substance Use Treatment Referral Line. We've got some different toolkits here from the Gun Violence Intervention Team. And then I wanted to show you one more thing here. There is another option as far as looking for a provider. So going back to that Annapolis, 1401 zip code here. And I want to point out something right here. The default on this is going to be just showing you providers that accept Medicare approved payment. You can click that off if you want, but it is the default. Now, as you can see, there's quite a few providers already on here. This is a brand new feature here, so this is still growing. It's got lots of room to grow. Let's go. I'm sorry, did somebody have a question? And so I filtered down by specialty. I went down to pain management, and you can see within 10 miles of my zip code, I have now narrowed it down to 14 practitioners who specifically recommend that they work in pain management. Now, I just wanted to point out something because there is such a good variety of people here. A lot of your organizations may already be on our website, but I bet there's a lot of you who aren't. So I would love if you would consider listing on Network of Care if you are an organization that thinks you can, that thinks this is an appropriate place for you. As I said, this is not just health, it's all kinds of social services on here. So how you would do this, up at the top bar here, just to the right of that little home thing, services has a pull down menu, and you would just go to add new agency and fill out as much information as you can. And when you're done, Network of Care is a national organization, so they review all of your information, make sure everything looks legitimate. And then the final thing they do before they post this on Network of Care is send it over to me, just to be another set of eyes, look through, make sure everything looks good. I tell them it looks good, and then it gets posted onto the Network of Care website. And the other thing I would encourage you to do, if you think that you might already be on the website, but maybe it's been a while since you've updated your listing, and I would ask you to take a look at your listing, and under the same tab under services here, you would go to update any listing. As you can see, they're alphabetized. So here's, I'm just looking under the A's. So look for yourself, and then you would click on your name, and from there it would take you to your listing, and you can edit and add any information that you need to make there, and then hit submit. And then again, Network of Care, the national organization, takes a look at that, and then they send it over to me. And once everybody's approved it, the changes are made on the website. But I hope that this is a useful tool that you can use. And there is so much more in here that I'm unfortunately just not going to be able to cover today. So as I said, I did put the link in the chat box. I'll also put my email in the chat box. So if you have any further questions outside of this meeting, please don't hesitate to email me at any time. Thank you very much for a very quick tour of the Anne Arundel County Network of Care website. I'm going to stop sharing.
Thank you, Dana, for being so accessible. We do hope that you reach out to her with your questions. Some of you may have noticed that staff members of the Health Equity and Racial Justice Office were wearing pink today. We are celebrating Breast Cancer Awareness Month. And with that said, would like to invite Christine Bloom to give an overview of breast cancer awareness and what we're doing here at the Department of Health.
Hi, everybody. Thank you. Oh, yeah, I think I can do this. Thank you for giving me permission to share my screen, and I'm sorry about how that looks. Yeah, I live by that. I'll be brief. My see if I can. Where's my slideshow? From the beginning. Okay, here we go. I'm Chris Bloom, and I work under Jennifer Schneider's bureau, the Bureau of Disease Prevention and Management, in the chronic disease prevention. So this is our mission in chronic disease prevention, but basically we're doing exactly what the bureau title or the program title says, trying to help folks prevent chronic diseases, and a big one is cancer. And thank you for having me today to speak about breast cancer specifically. I put some slides in here that sort of help orient to where we fit our cancer screening services program. And the way we do this is by certainly with help of community partners, but I have a lovely staff of community health educators, administrators, nutritionists who attend live and virtual events. This is a little data. Last year, we reached over 500,000 at events, and there's some of our topics listed: nutrition, obesity, tobacco use. These are this year so far some of the events that we've in-person attended, virtually attended, and distributed materials to. So it gives you an idea of where we are in the community. I'd like to give a special shout out to all of our community partners. Here's a list of them who help us do this work. And this is, by this work, we have tobacco cessation partners. So they're like Anne Arundel Medical Center, BWMC, St. John's College, Anne Arundel Community College, and Bay Community Health all provide smoking and vaping cessation services for us. The rest of our partners do anti-tobacco and vaping messaging, anti-cancer messaging, and like with our health ambassadors, we certainly couldn't be in the community and do our work without them. I'm going to skip over that. But tobacco enforcement, this is another division that we have. Again, it's all in the vein of helping to prevent cancers, specifically lung and other related. We work with Anne Arundel County Police and Annapolis City Police for law enforcement, tobacco law enforcement efforts. And these are just statistics from this year so far. We do retail compliance checks, and I'll skip over this unless you want to. My email address is included here at the end. If you want to hear about this, I'm happy to talk about it, but I know we're short on time. These are, again, just some of our initiatives for anti-tobacco use, things that we do in school, in the schools. We have a Brooklyn Park Healthy Food Pantry. Last year, we were able to reach over 5,300 families. And again, at those, because it's a healthy food pantry, the focus is on nutrition education. So teaching folks about healthy nutrition to avoid cancers, heart disease, diabetes, that kind of thing. And here we get to our wonderful, beautiful, the reason we're all here today, that I'm here today to talk about is breast cancer services. And that's up at the Magathie Health Center in Pasadena. That program has been running for, over 40 years. This service, the Cancer Screening Service Division, covers not only breast and cervical cancer, but we've added lung cancer to these services. And specifically regarding breast cancer, though, we want folks to know that the services provide for no cost screening and treatment for the community if they qualify. And there are phone numbers there for you to call. The intake workers, the nurses and administrators there will do a little financial assessment, but you can qualify if you don't have health insurance, or if you have like a high deductible insurance that won't cover these services, and they hold your hand and walk you through every single step of the way. It's really lovely. And last year we served 923 clients. This is so far since July 1st. These are already the number of people that we've screened and serviced for breast and cervical cancer. And that number, we add on to it every month. I know Dr. Lalesh and Jen and Christy receive this information every month, and we're really proud of that work. This is just a list of the staff that help in our division. And there's my email address and phone number if you'd like to reach out to me. Thank you.
Thank you so much, Christine. If you do have questions or comments, feel free to reach out to her directly. You can also send us an email at healthequity@aacounty.org. We certainly want to hear from you. Thank you to all of the speakers during today's meeting. We appreciate the content that you've shared with all of us. Thank you to our senior leadership and staff members of the Health Equity and Racial Justice Office. We appreciate the role that you played in making sure that this meeting ran smoothly. So thank you. I want to just say again that we invite all of our community health ambassador, partner representatives and leaders to just remain with us for a group photo. We appreciate your participating in that. The holiday season is fast approaching. That means that we may not meet again until the new year. We do want to stay connected. And so if you have feedback, if you have ideas on how we can do things better in the new year, of what we can do to work collectively, again, to make sure that everyone has a fair and just opportunity to achieve their best health here in Anne Arundel County, please feel free to reach out to us. We're here, our door is open, and we want you to feel free to raise your voice. We're going to conclude today's meeting, but again, we thank you for your participation. And if you would like to share your comments or questions, you can do so directly at healthequity@aacounty.org. Thank you so much. Take care.